This is one of those conferences where you pay for the whole seat, but I think we only really need the edge of it, right? It's just one of those awesome, can't wait to get there, and then surprised it's over so fast. But my name is Matt Ohrt. I'm from Wisconsin, and Wisconsin is a really cool state. We're the number one in cheese, so if you like cheese, it's a good place to go. We're number 2 in dairy, and number 10 in manufacturing, so a very cool Midwestern feel to it. I lived there now 17 years, and married to my wife for 28. We've got 4 kids, plus 1 adopted. We're also foster parents, so we're active in the community and care about the community, and about 30 or so kids come through the home, and then we have a 3.5-year-old foster that we've taken about 5 babies home, and then we got a 6-month. We're still actively at, but one thing you'll learn about me is that I'm a very simple man, so farm boy from Iowa, and so I had one person tell me that. He said, "You don't have to tell me that, Matt." I'm like, "Oh, is it that obvious? You know, what gives it away is that I take my tractor to the grocery store, or that I drive 15 hours to Oklahoma instead of fly, so you get an idea of what I'm about." But just Wednesday night, so quick story and we'll jump in. So Wednesday night, I'm in my room and I take off my belt, and you know that little prong that goes into the hole? It fell off and it broke. It's like broken. I'm like, why do these things always happen to me? So I'm like, I didn't bring a spare belt, and so I'm just, okay, problem solving. So the next morning I attach it like it is attached, but it's not attached. And so I put it into the hole and it actually stays. So, but if you see me pushing on my belt, you'll know why. And if my pants fall down, it's not part of the show, I promise you. So just know that as a disclaimer before we start. Okay, so where's the clicker? I don't think I'm kidding myself if I think I'm skinny enough to worry about that anyway. Let's see. All right, so Cheeseheads in Wisconsin. We love cheese. I'm actually going to a cheese expo next week, probably only in Wisconsin. So a little background on me, just a quick context of who I am. So I actually always had a very entrepreneurial spirit, but actually worked for employers for just short of 25 years, leading human resources. And the first 2/3 of my career, I was like most HR people. I went through the healthcare, and I did the enrollment meetings, and I gave the bad news, and we moved on. It wasn't like managed like it should be as the second or third biggest expense. But something changed. In 2016, I took a role at Merrill Steel, and everything changed for me. In fact, my whole career would take a turn or change after that. So I was the VP of HR, and 2 things happened. The owners approached me, and they said, before you got here, our healthcare costs have been going up 5 years in a row, 9 or 10% a year compounded, and we've been absorbing that. And we can't continue to absorb that. We need to protect our employees. Is there anything we could do? So we didn't really know. I started learning. I found there was a complete lack of books on the topic, and there was a few and so forth, but it was a lot of self-learning and figuring stuff out. So we went on a journey. We started rebuilding our self-funded health plan. We were already self-funded. We were just lacking a medical strategy. And so we built it from scratch, and we built it around DPC and through DSC and so forth. And that's not the topic today. That's the nuts and bolts of what we did. But we found ourselves 5 years later saving about 20% off the total plan spend, which was about $5.5 million. And it led to just some really cool things, lots of awards, started a healthcare best practice group in the state, which has grown significantly, even led to a book. And now I'm traveling all over the nation, 12 states in 10 months, and just some really, really cool stuff. You see the picture there, and that I always say I got into healthcare by accident. So we had started and we were doing good things, but then I was actually in my backyard directly run over by that 4,000-pound tractor, which led to a bad ER experience, kind of an uncaring ER experience, and a really bad billing experience, as you might imagine. And so I was extra motivated, and we absolutely transformed everything after that. So I'm excited to share with you. We're doing some really cool things in Wisconsin. Let me give you a few just quick samples of what we're building together. So in 2020, there was an article there in the upper left that showed that we had 15 DPCs in the state. Today we have 123. And so, isn't that awesome? And so you can see how the doctors feel about what's happening in the systems today and how they feel about offering the right care. We actually have, I can't hardly see, but we have, interestingly, so Dr. Usher, could you guys maybe just stand real fast, and it'll also help me, and Jessa, not if you're in the room, hopefully. If not, where's Jessa? Okay, so these are a couple of the first DPCs in the whole state. So roughly 2010, and I think both of them started in Dr. Usher in 11 and Solstice in 12. But that was when it was very new and very conceptual even at that point. We also happen to have, if you could stand, Jill and Marina are here. Stacy had to go. I don't know if they're in the room. Oh, there we go. But we also have the newest one, which is really cool how that worked out. So the 123rd one. So, yeah. So congratulations to all of you, and thank you for your courage and for what you're doing. So you see just kind of an idea here. If you look at the imaging, so if we just take kind of 3 categories, we have many more. We actually have everything outpatient, but say 5 regions of Wisconsin, and then you'd say imaging, infusion, lower level infusion, not always oncology yet, and then the surgery centers. We have all regions. There's a little gap for surgery in the center of the state, but we're just right, cover this, cover this, cover this. A doctor pops up, help them, encourage them, advertise them for free, whatever we can do. What's interesting, if you go back 3 years, only 3 of those bullets, 3 out of the 15, if you will, in the regions and the specialties, there's only 3 bullets just 3 years ago. So that's kind of the movement that we're seeing. And then lastly, in the bottom left there, you see the Johnson & Johnson case. Ann Lewandowski, whom I know well, has helped me with presentations like this and just texted me yesterday. And so we know her well. She's actually going to be, I'll share, at our August little event we're having in Milwaukee conference. She can't talk about the case, but if you want to meet Ann, she will be in the audience that day. So kind of leads us to, I get a lot of questions, right? How did you get so much traction? And I thought it would be cool to just kind of go through that. So I came up with 5 things. How can we get traction in our states, right? We have the answers. I think now there's, of course, many new still learning and so forth, and that's all great, but we have the answers. But how do we get people to do it? Because the greatest, a strategy can be great, but if no one uses it, then we're still not winning. So how do we boost the movement, if you will? And so first, make it a thing. So you can step in informally, which is kind of what I've done. No one appointing me to be the state leader, and I don't even call myself that. I'm just with the doctors and with the employers and do what I can to support. But part of it is to think bigger than just your business. I see a lot of that. It's like, I only care about my business. Okay, that's good. But I would ask this. If you're a mature business and you're stable, right? If you're starting out, I get it, right? Make it go. You got to make it go. And I haven't seen one fail. I haven't seen an independent practice fail. There's probably one there somewhere, but that's a big deal. So we prevent that. But just think about the movement in general. Maybe it's 5% of your day. Maybe it's 30 minutes to another doctor just to help them, to an employer, whatever it may be. So just be careful not to be in that little box. And then just have a clear narrative. I mean, you can come up with, there's lots of ways to say what we're doing. One of the things that I say is our goal is to restore trust in healthcare, right? And another way to say it in terms of driving that movement from the state picture is that the movement is like the oars of a rowboat. One is the buyer side, the employer, self-funded employers and all the patients. And then the other side is the seller. In this case, it's independent practices. We'll mix in, hopefully, hospitals as they come to the free market side. But if one of those oars is not rowing, you're going in a circle. If one of those oars is even rowing slower as we try to grow this, then you're certainly not going straight. So that's just one way. It kind of sticks in your head, right? It's like, the 2 parts. Oh yeah, the rowboat thing. So using analogies and being creative. So number 2, gather the troops. I would say this is maybe the most important, if I had to pick one, I started back in 18 with, first it was actually an email, and then the next email I'd go in and copy the addresses I sent, weren't even blind copied yet. And then it transitioned to a spreadsheet and eventually to MailChimp for legal reasons. But what we started out is what we called this healthcare best practice group. When I won all these awards and the phone wouldn't quit ringing, how'd you do it, Matt? How'd you do it? I didn't have time to, spend all these hours. So I said, let's start a healthcare best practice group and let's collaborate. And this has really kind of transitioned as I become the FMMA leader, kind of one and the same. But you can see the growth. What's interesting is when that book came out in 2012, I even wrote in the book, we had 1,200 people and about 300 employers. Just since then, that was July of 23, we now have, this is even out of date, every month, right? This is now 3,400. So I can't even keep up with it. In the bio, I think it says 3,200, right? It's like, that's how fast. So isn't that cool? And then a friend of mine, Bob McCollins in Arkansas, I don't think Bob's here, but he said, man, it's just PLU. And I'm like, what's PLU? And he said, people like us. I'm like, I like that. And I was talking to a lady named Marcy in Boston a month ago on the phone, and she was in Harlan's podcast on LinkedIn, and she's all excited. She calls me. She's like, I found my people, right? So I think there's a lot of that. Now, maybe this resonates. We've got a lot of new students here hearing things for the first time. Maybe it resonates, maybe it doesn't. That's cool, whatever. Like, this is all about choice, isn't it? We just want choice. We want alternatives. We don't think anyone should be forced down a path. And so it's interesting, and I'll kind of keep it fun here, but if you know me, you know that I'm interested in lots of things, but the American Revolution and the Civil War, and I just study American history. So I thought, I was reading this book right here recently, and it's talking about the movement. It's Paul Revere's life. It's using movement and all these things. I'm like, man, this is, because I've been studying, how do you lead a movement? What do you do, right? So I've been passionate about change my whole life and leading transformation, but not at this scale. But it's amazing the similarities. So I thought I'd just kind of finish this talk on the similarities there. So one is, if you look way back, this is the late 1700s, the colonists, as they're called, right? They wanted to defend their freedom. They felt like their freedom was at risk. They weren't looking for a fight, but they did feel their freedom was at risk, and the Concord mission kind of sparked the war, if you will. But they had been in a war or fight about every generation from the French and Indian wars, and they didn't want war. They lost family members. It was bloody. They hated war. But here's the interesting thing: after the Concord mission, one of the posts, they could get on the horses. That was the fastest way. Share this post, share this letter for consistency. It said, our all is at risk. There was one newsletter that came out that said liberty or death. And if you look at their behaviors, they didn't want to fight, but they were willing to fight to save their freedom. They'd rather fight for their freedom than just be controlled. And so they were certainly grassroots in structure. They couldn't form a government, right? They were still under the British control and so forth. So it had to be all grassroots, and everyone participated. If you look at the Concord mission, for instance, which is described in both of these books, number 2 especially, if you had to pick one, pick number 2, in my opinion. I couldn't wait to turn the page. Like, this is inspiring. This is educational. We can learn how to lead this thing. But these weren't, they had small, what they called training bands, but these were farmers. They were still in their farm clothes. These were people from stores in town, but every one of them, the children had, even if they're old enough, they had a role, and the foremothers and the forefathers, they all had a role. Nobody said, I'm going to run my store, I'm out of this. Nobody said, I'm going to plow my field, I'm out of this. They all were together. So kind of neat. So number 3, push for momentum. And there's many ways to do this. In Wisconsin, the last 2 years, we went around the state. We call them road shows or educational sessions. We'd make just enough from a few sponsors to pay about $3,000 for room and coffee. And then we'd put on these sessions, half a day usually, sometimes a full day. But I called those brush fires. I talked to a friend. I said, how do you do a movement? He said, you're really just lighting brush fires everywhere. This is like the big bonfire, right? So then we need to go back to our states and lead brush fires. But we are having a kind of a bonfire in Wisconsin at the end of August, the first annual Don't Feed the Beast conference named after the book. right? We're not fighting the beast. I didn't name it Fight the Beast. Just don't feed him. Let's have good alternatives. That's going to be really cool. Have a comedian there for fun. Actually, Miss America lives about 20 minutes from me. She was Grassroots. She was Miss Wisconsin. She's going to come in and stop in. We've got Marshall Allen coming. We've got a whole long list. Julie Selznick, Keith Smith. Going to be really cool. So you'll see that if you're interested in that, let me know. The registration will be coming out very soon. We had shared it with a few employers so far. And then how to lead this thing, right? So how do we turn all these nuts and bolts into action and progress and continue our momentum? I would say just kind of, we all have our own leadership style, but empathy, passion, and lots of encouragement. One of the things I do to strengthen the movement is anytime I see someone do something that moves the movement forward, I'll like a LinkedIn, right? I'll text them, I'll call them, encourage, reinforce, right? Anytime a new one opens, go there, take a picture, advertise it as time allows, but just do everything we can to encourage. And then being creative and memorable. You see that, like this last year, I did the year-end video at a dairy farm. Kind of cheesy, I know, but I'm a farm boy, and so I called it "We're Moving the Movement." There were cows in the background, so that's on YouTube if you want to see that. But you remember it, right? It's a little bit out there, but you remember it. And when I say people and they come up to me and they're like, "The movement is moving," like, yes, it is moving. And so, kind of a quick point here is that so you say, Matt, okay, we're talking about leadership, stepping into the leadership of the movement. But, I really don't want to offend anybody right? It's like that. We all struggle. I struggle with that. Like I'm a disruptor. Does that mean troublemaker? I hope not. Yes. So I would say just for us to be careful of the misguided thought that we'll be liked by everyone. I don't think we're liked by everyone anyway. But if you jump into the spotlight, you're going to get some criticism. Doesn't mean it's even fair. They're entitled to their opinion. That's fine. But I sometimes I'll say, well, just what part of the movement are people offended by? The compensation alignment or the trust or the transparency or the quick accessibility or quality of care? Sarcasm inserted a little bit, right? But just what part? So I don't think we're doing anything offensive, so we got to say it well. But that's okay. If you're offended, okay, and you don't like this, that's okay. But I don't think we're doing anything that's really that offensive. Number 4, so communicate in many ways, right? So just kind of a contrast here. We are so spoiled on communication, right? But be visible. Be visible. LinkedIn, maybe it's a video. I started a monthly webinar having Aaron Albert from Mark Cuban Drug Company on in April, if you're interested. I'll get you a link. But just kind of every way possible to utilize those communications. We should, right, this is good to come to the big bonfire, if you will, but you know what? And there's only so much time, but we should know each other. We should have each other's emails. We should have each other's cell phones as relevant. So it's more than just, hey, we had a great conference. We should be talking throughout the whole year. It's got to be a networking thing. And so I'm about to launch, actually it just did launch, just as a heads up, you see the book there. I'll be doing a book signing after the conference too. I had missed the original one, so if you're interested in book signing or a book, let me know. So we'll be out there. But some online courses. So starting with overall the book and how to do it, and then how to lead a movement and those kinds of things, how to get traction here. There's a QR code for you if you're interested, or it's at healthcaresuccessformula.com. And then private community to support. So I have lots of people approach me in different states. I want to lead this. I want to push our state forward. So private community to join that I will be a part of how we can do that together. How can we do it in other states, what we've done in Wisconsin? I know other states have been active as well, but how can we continue to drive that? And then if you contrast that with the kind of communication we had in the American Revolution, they used what they had, right? Very different than today. But the fastest way, I think, were post riders on horse. You want to go faster? Well, then get a faster horse. That was it, right? And then there were different ways. One light in the steeple, one lantern in the steeple meant by sea. 2 meant they're going by land on the Concord mission. 2 lights in that steeple told the whole countryside that they were going by land. They started at midnight. The whole countryside knew that the British were marching. They didn't even tell the soldiers and the troops didn't even know until halfway on the Concord mission where they were going or what they were doing. The whole countryside knew before them because they communicated well. How interesting. Musket shots into the air. These were the alarms that were going off. The British, right? Actually, they said the Redcoats. Many of the people were actually British heritage. So it wasn't the British are coming, it was the Redcoats or regulars. But the Redcoats are coming, the Redcoats are coming, they're really coming. 700 or 800 of them marching down the road. They're coming to disarm, to everything that's at Concord. And so church bells and drum songs, the drums actually meant something. The songs they played, call to action and so forth, reload or, fire and reload. So the drums were used even in the war as a way of communicating. Kind of interesting. All right, moving to close here. The last one, tap into the American spirit. So as you read these books, Paul Revere was much more than a midnight rider. He was actually interestingly, I would call him the leader of the American Revolution movement, at least at the beginning. And doctors, here's an interesting point for you. Doctors in the house. I'll read this. So, several Whig messengers that night were physicians. In that far distant era when American physicians made house calls, a country doctor was apt to own the best saddle horse in town and be a highly experienced rider. The doctors were actually participating in sharing the message and alarming the countryside. So Paul Revere was a joiner or a doer, right? He's connecting the right people. All the work was done before the ride was done before the ride. He knew everybody and so forth. And they had a plan, they had a process of what would happen if the British were coming, if the Redcoats, were coming. So he had relationships, he was everywhere, right? He knew, oftentimes they tell him, hey, the Redcoats are coming tonight. He said, yeah, they're the third person that told me that, but thank you. That's how connected they were. So he was described as the Mercury of the American Revolution. On his ride, many don't know this, he was actually captured. They took Brown Beauty, which wasn't his horse, but was the fastest horse in the area. They took the horse. He is walking with them. He's captured. And they're hearing musket fires, and they're hearing church bells, and they're hearing drum songs. And they're starting to, what is that? They ask him, they put a gun to his head. Honest, they said. He said, you don't need a gun. I'll be honest anyway. And he wasn't afraid. What is all that noise? He said, we've been doing this before midnight. He said, the countryside is being alarmed right now that you're coming. There's 200 or 300 gathering over here. There's 200 or 300 gathering over here. They called it mustering. There's 200 or 300 mustering over here. They had 700 or 800 troops. Before the day was over, they would be running back to Boston 18 miles, surrounded by almost 4,000 militia and farmers who had gathered around them, and they had a third of their people had casualties. It changed the British impression of these country hicks that they saw. Maybe they weren't so country hicks. In fact, they called them peasants and rebels. And they weren't even doing it to insult them. That's just how they saw them. But that's what they called the colonists, the early Americans, who would become the Americans, and non-Tories. So the Tories were the loyalists. There were a few of those, but the majority were interested in their freedom and threatened by that, by what they called the Coercive Acts and the Stamp Act. It was actually named the Coercive Acts. So we come to a close here. So if Paul Revere were in our shoes, what would he do today? The Stamp Act was a few pennies, and he was very concerned about that and stirred things up over that. Is our medical freedom being infringed upon? Is it at risk? And is it a time for a call to action? So I'd mentioned the ways they communicate, and so one of the messages was a call to action, right? Muster the troops, the 4,000 on that day, 200 here from this area, 300 from this area. So I thought I would just play some 10-second clips of what that would sound like. So if we could have the first one. And I mentioned the drum songs had meaning as well. So there was drum songs that meant call to action, that meant muster. So if we could hear that one. So kind of put you in their shoes a little bit, right? So we might have a modern day version that the redcoats are coming, because I think it's fair to say the Bukas are coming, yet so are we. So the rebels have been awakened, and the cavalry is coming to enable fiduciary responsibility. The lawyers are coming behind them to make sure it's carried out. And the white coats are coming for medical autonomy and to restore the doctor-patient relationship. I'll close with this. My fellow peasants and rebels, may we rise up and take back American healthcare. Thank you.